week, especially in male. It happens more in male because of the prostate, and as you can well see a little bit on this picture, the prostate is right over here. And so what happened is that when the male has enlarged prostate, the canal that brings what we call urethra, that brings the urine out, gets compromised, and basically urine comes in, stays in the bladder, and then basically you get a lot of abdominal pain because urine keeps going into the bladder, but it cannot empty fully. One way that we tell at work is that we have a little scanner, and so we'll see how much fluid there is in the bladder, and this is where we'll put the Foley. So that will be a quick solution for both sides. And so I mentioned in the past about the usefulness of a Foley catheter. In my mind, it would be a better tool than having a blood pressure cuff or anything in slice weight, and is multiple use. And funny enough, I find there's not a lot of people talking about it, but it has so much use and can solve a lot of issues that I don't quite understand how come people don't talk more about the Foley. But basically here you see how it works. So this is the Foley here, and there's a little balloon. It goes into your bladder and stuff, and obviously this is in the male, and in the female it works exactly the same way, and it goes in and stuff, and it's relatively easy to learn how to insert. But if you have especially a male saying that they've been having, even if they have a urine but it seems like it's not enough, it's like they feel like they go to the washroom but they need to go again because again the bladder cannot empty, putting a Foley will mostly solve a lot of their abdominal pain. Another one that is actually a surgical emergencies, it's called a testicular torsion. Mostly happens in younger population, but it can happen to pretty much everybody, and mostly it's on one side. And there's a quick test, it's called a cremasteric test, and it's basically a reflex. It's excited by stroking the medial thigh, and I'll show how it works. And if typical absent in testicular torsion, so that means like when you push, your testicular should go up, and if it's not, if it doesn't go up and doesn't move, what we call a negative predictive value, it means that if it's there, so if you have the reflex, you're 90% sure that you do not have the disease. Doesn't mean that you so that's why negative pressure is that if you have this, you're 90% sure that you do not have the disease. That's why it's negative predictive. And this is the test. So basically you just stroke over here, and you should look at the testicle on the side, and it will raise up. So as you stroke the hand, it's a reflex. So it's a little bit just like when you go to the doctor or healthcare professional and they hit your hammer, the hammer on your elbow, and that's the same thing. And so you stroke the inner thigh over here, and you should see the scrotum, the testicle, sorry, going up. And if you don't see this, then that means there's a good chance that you may have the torsion. So mostly it happens with either a trauma or something. They have pain in the scrotum on one side, very large amount of pain. When we hear any person with scrotum pain in emergency, we try to rule that one out very quickly because, like I said, it's a surgical emergency. So now, if you're in a, what could I do? So there is things that have said, so a manual detorsion should be attempted if surgery is not an immediate option. So for example, if you're whatever disaster and you're not capable of going to an emergency or a hospital right away, and this is why you're doing that test on yourself or the other person because there's nobody else there to do it, this is how you do it. So you hold the testicle between the thumb and the forefinger, and you can detorsion of stuff. You can look on YouTube; they'll there'll be a few videos and stuff. You hold the testicle between your thumb and the forefinger and twist 180 to 30-60 towards the other side. So ipsilateral tie means like on the other side. And you should have a rapid relief of pain and swelling should ensue. So basically, just like imagine that you have a balloon and or a Ziploc bag that you twist and it gets bigger. That's exactly what happens. And so basically what you want to do is you want to untie the bag on the other side. So you can try that, and I would start thinking again. This is to make this decisions, but I would start because just even to relieve it doesn't mean that there's no other complication. You could probably monitor after that, but that would be maybe one of those that I would be thinking of going towards the facilities if there was no relief and things like that, because complication, because obviously what could happen is this could be necrotic, so it would literally die, and then after that you could have like pretty severe stuff like septicemia and all that stuff, because you got a necrotic things attached to you, so it has to be surgically repaired. So that was the male part. Now we're gonna the not so male part that kind of happened to everyone. So our belly is separated in little corner like this. Depending of what you read, there's different ways of like separating and stuff. The reason I choose this one here is because you can see it would be a nice picture to have inside like a first aid kit or your kit, because basically now you can see every disease that are related to the corner. So for example, if I have pain over here, it's most likely appendicitis. On this growing pain, it could be inguinal hernia. So this is why it helps you. And each corner has their stuff. So you got the right and the left. So if I separate, for example, right at the belly button, and the belly button is important because that's like the center and it helps. So around the belly button is what we call the epigastric, periumbilical, region, and then the epigastric region is right here where you have the epigastric hernia, and then you have the right upper, so right upper quadrant, the right lower quadrant, the left upper quadrant, left lower quadrant, and you have the pubis here. And so this region, the lower part, is called suprapubic region. And so depending on where you have the pain and when you're, if you palpate, if that kind of be able to help you. So basically it's kind of a map that can help you as well. This is more based on patient history. So do they have pulmonary symptoms, urinary symptom, or colic? And obviously we won't be able to do ultrasounds or CAT scan, but it's just to kind of help you decide, oh yeah, okay, it could be because for example, if you look, this is right at the bottom of, so over here is your lungs, and so some people sometimes like in the epigastric region here, some people will feel this and it's actually a chest pain. So it's like a heart attack can sometimes be felt here. So not because they're happening in the belly, that means and stuff. So the same thing here is sometimes if you have very low pneumonia or things like that, it could be actually a respiratory issue, not an abdominal issue. So this is what this this kind of this line is from. The urinary symptoms, so basically you have to ask yourself, are you having pain when you pee, or and this is where the dip can come out. And colic is more like what kind of abdominal pain and what kind of issue they have. Patient with history of fever or pain in the periumbilical, so around the belly button, or the right lower quadrant pain, most likely you want to rule out appendicitis. And appendicitis, so there's some studies, so it's a surgical procedure, but now there's some literature that comes out in very, very specific case that they're treating it with antibiotic. If you want to go through this, I'll let you do the research and do your own thinking. The problem is that a lot of those research, because for example in place like Africa and things, and especially in pediatric, if you can save them from having a surgery, that would be a good thing. But the problem is that the antibiotic has to be intravenous. So this is why a lot of time when I did my little speech on antibiotics, because you're taking a pill, a PO antibiotic, doesn't mean that it's going to work. And in this case, it's a good one. And not because they say, oh, take antibiotics and you'll be cured from your appendicitis, that the antibiotic that you're taking is have the bioavailability to help your cause. And so in the appendicitis right now, all the studies shows that it's you have to give like some dose intravenous. So maybe you could think about giving some antibiotic if you suspect this and you're very in a dire situation. But again, then depends on the antibiotics you have, and so I'll let this decision to do. But I just wanted to make the note. There is some literature that shows that. So when you want to rule out appendicitis, there is basically 3 tests that you can do. The psoas, basically what you do, so basically the pain is where that number 3 is. Most likely they'll have like the pain right over there. And so one test you can do is you press on that number 3, and if they feel the pain around the number 2 or on the other side, that can be a sign of appendicitis, because there's an inflammation of the around. The other test that you can do is what they call the psoas. So it's kind of a nerve that attached near there, and what you do is you put the person on the side and you pull their leg back. So if they feel the pain worsening on the right side, it's most likely appendicitis, and you can see it's about 79 to 95% specific. And then another one that you can do is you make the person laying down, and what you do is you bend their leg at 90 degrees and you bring the ankle left and right, and then if they're so you kind of turn their legs like this, and then if the pain worsening, and it's most likely appendicitis. So those are kind of quick signs that you could do if you're not quite sure if it was appendicitis and you don't have a CAT scan and you really want to make sure, because the situation is dire straits and the hospitals are overwhelmed and stuff. That could be a way that you could say, okay, we'll sit this one down, or we need to go. As you can see, those tests are 13 to, so they can miss a lot of appendicitis. Does that mean all the appendicitis will have those? But it can be extra information that yeah we need to get out, or no we don't. And other problems here, as you can see, patient with history of or diverticulitis disease, rectal bleeding can be another ones to kind of rule out information. And then for this, there's this test called Imocult, and basically what it is that you take a little bit of stool, so you don't have to go in and take the stool if they have a bowel movements and stuff, and you take that little stick and put it on 2 sides of that little square there, and then you drop. It's very easy to do, and so you drop one of those that tester on a little. There's little round slots, and you put that on there, and then you turn the the Imocult, and what it's going to show you is that if there's a color blue that comes in, that means the test is positive. So Imocult stands for Mo is blood, and occult means like it's not visible. So what it means is that some people will have such a small abdominal bleed that they don't have like bad black stool, or they don't show major bleeding, but there's a bleeding still happening, and this is what helps us with that. And so, for example, if you have someone that feels very weak and you take her hemoglobin and his hemoglobin is low, and I'll talk in the lab, there's a way that we can do that, and you cannot find any cause of where they can be bleeding, that would be another way that you can say if they're bleeding from the stomach, from the stools. So that's pretty much the test. So give a lot of information. I hope that it will be helpful. Abdominal pain is a very complex issue. Like I said, it can be sometimes surgical, sometimes medical. But I was trying to give pointers and stuff so that people can build a little bit of a kit. And based on this series, I think I'm gonna the next series I'll try to get more into lab tests and things that we could do, and so I'll point my research that way to make like a little kit that could be portable, and also people could determine and talk a little bit more about them. Until then, I'll talk to you soon.